Hello everyone, my name is Dr. Samara White. I'm a pharmacy resident here at Buffalo Psychiatric Center, and today we'll be talking about allergies. We're going to talk about what allergies are, the different types, and how severe allergies can be. We'll learn how to tell the difference between having a cold and having allergies, and last we'll talk about medications for allergies. Allergies occur when the body's immune system sees a substance as harmful and overreacts to it. The substances that cause allergies are called allergens. The symptoms that result when the body overreacts are known as allergic reactions. Examples of these symptoms are itching and scratching, breaking out into hives or rash, watery, itchy eyes, redness, runny nose, sneezing, wheezing, pain, and swelling. Once again, allergens are the substances that can cause allergic reactions. Some example allergens are pollen, trees, grass, poisonous plants, dust, mold, mildew, animal dander, bee stings, nuts, shellfish, milk, wheat, soy, and even latex. These allergens can stimulate an immune response, or in other words, you can have an allergic reaction by inhaling, ingesting, injecting, or skin contact with these allergens. Seasonal allergies are also called hay fever or allergic rhinitis. These are the typical allergies that most people think of. These can get pretty bad around March to July for tree and grass allergies, or during fall for ragweed and mold. Some common symptoms are itchy and watery eyes, runny nose, and congestion. Skin allergies are also known as atopic dermatitis. These can happen if you have sensitivities to some lotions, soaps, or even cheap jewelry. Some symptoms you'll see with these are itchy, red, flaking, or peeling skin, or also hives. Food allergies can be pretty severe. Some symptoms of food allergies are hives, tingly or swollen lips, tongue, face, or throat, or anaphylaxis. And we'll discuss anaphylaxis in a couple slides, but just know that it's a serious allergic reaction. For insect allergies, you'll often see swelling, itching, hives, shortness of breath, chest tightness, and anaphylaxis. A common example of an insect allergy is being allergic to bees, and this can be life-threatening for some people. And finally, we have medication allergies. Some common allergies to these are penicillins, sulfa antibiotics, and some anti-seizure medications. With these allergies, you'll often see rash, hives, a swollen face, or anaphylaxis. A common question is, how can you tell the difference between having a cold and having allergies? There are many things that overlap, but I'll point out a couple of the key features that can help us tell the difference. First, the duration of a typical cold is up to 2 weeks, but allergies will occur for as long as the person is exposed to the allergen. Typically, colds happen in the winter because people are spending a lot more time indoors, and this allows the virus to spread easier. But they can still happen year-round. Allergies, on the other hand, can occur at any time, especially for those who are allergic to animal dander, certain foods, or skin allergens. But we also know that the typical allergies that we think of are seasonal, mostly spring and fall. How long it takes symptoms to occur is one of the ways that you can definitely tell these two apart from each other. With a cold, it takes a couple of days, and sometimes you can feel the cold getting progressively worse. With allergies, symptoms occur immediately when people are exposed to allergens. As far as symptoms, cough is a little bit harder to distinguish because it happens often with colds and sometimes with allergies. A symptom that is easy to tell apart is body aches, which happens sometimes with colds, but pretty much never with allergies. Fatigue is not something that you would probably be able to tell apart since it happens sometimes for both cold and allergies. Fever is another symptom that you can easily tell these two apart with. With colds, it can happen rarely, but with allergies, it's pretty much never. The same is true for itchy and watery eyes. It happens rarely with colds, but often with allergies. Having a sore throat is a little bit harder to tell the difference between. With colds, it happens often, and allergies, it happens sometimes. And finally, a runny or stuffy nose happens often for both a cold and allergies, but with colds, the mucus is usually a greenish or a yellowish color, whereas with allergies, the mucus is clear. Next, we'll talk about the severe cases of allergies. Extremely severe allergic reactions are called anaphylaxis. These are life-threatening, potentially fatal allergic reactions, and these can happen very quickly, from a few seconds to a few minutes. The symptoms include swelling of the throat and tongue, which is very dangerous because this can prevent breathing. There may also be a loss of consciousness or passing out, severe shortness of breath, a weak but rapid pulse, and then potentially skin rash or hives and nausea and vomiting. The cure for anaphylaxis is using an EpiPen, which contains epinephrine. People with very severe food allergies or allergies to bees should definitely carry at least 2 EpiPens everywhere they go, just in case. Here's a video about anaphylaxis, and then we'll watch one about using an EpiPen.
Anaphylaxis is a severe allergic reaction that can develop within seconds or minutes of being exposed to an allergy trigger or allergen. A person who is experiencing anaphylaxis may have trouble breathing and go into shock. Because anaphylaxis is life-threatening, it is critical to act quickly to stop or slow its effects. To recognize anaphylaxis, look at the situation and the person's signs and symptoms. If you know that the person has been exposed to an allergen, look for trouble breathing or signs and symptoms of shock. Remember that signs and symptoms of shock may include excessive thirst, pale, cool, moist skin, changes in level of consciousness, and a rapid, weak heartbeat. Unknown exposure plus trouble breathing or signs and symptoms of shock equals anaphylaxis. If you think the person may have been exposed to an allergen, look for any 2 of the following signs and symptoms. Any skin reaction, such as hives, itchiness, or swelling. Swelling of the face, neck, tongue, or lips. Trouble breathing. Signs and symptoms of shock. Nausea, vomiting, cramping, or diarrhea. Any 2 of these signs and symptoms, in combination with suspected exposure to an allergen, equals anaphylaxis. If you do not know whether the person has been exposed to an allergen, look for any skin reaction or swelling of the face, neck, tongue, or lips. If the person has a skin reaction or swelling, and the person is having trouble breathing or showing signs and symptoms of shock, then assume anaphylaxis. When you recognize that a person is experiencing anaphylaxis, have someone call 911 or the designated emergency number immediately. If the person has a prescribed epinephrine autoinjector or an autoinjector is available and you are authorized to use it, help the person use the autoinjector. When administering an epinephrine autoinjector, be sure to hold the leg firmly during the injection to limit movement of the person's leg. Remember that anaphylaxis is a care-first situation, so if you are alone, help the person first and then call 911 or the designated emergency number.
Now we'll watch a video on how to use an EpiPen.
If you or your child has been prescribed EpiPen, or if someone you know has severe allergies, it's important that you learn how to use EpiPen correctly. That way, you can feel more confident and prepared in the event of a severe allergic reaction. In the case of an allergic emergency, every second counts. That's why it's so important to always have easy access to EpiPen and to use it at the first sign or symptom of a severe allergic reaction. Here's how. EpiPen is administered in 2 simple steps. Grasp the EpiPen autoinjector with the orange tip pointing downward. Blue to the sky. Remove the blue safety cap by pulling straight up. Do not bend or twist it. Orange to the thigh. Place the orange tip against the middle of the outer thigh. Swing and push the orange tip firmly into the mid-outer thigh until you hear a click, and hold on the thigh for 3 seconds. Count slowly. 1, 2, 3. EpiPen will work through clothing if necessary. After EpiPen is used, the orange needle cover will automatically extend over the needle. This safely covers the needle as the autoinjector is pulled away from the thigh. You will not see the needle before, during, or after use. Do not try to reuse EpiPen or EpiPen Junior after the device has been activated. Remember that using EpiPen does not replace seeing a doctor or going to the hospital. So call 911 or go to the emergency room right after using EpiPen. Remember that the effects of epinephrine can wear off, or a second reaction could occur. If symptoms continue or get worse, you can use another EpiPen or EpiPen Junior 5 to 15 minutes after the first dose. That's why you may want to have more than one EpiPen autoinjector handy. However, more than 2 sequential doses should only be given under direct medical supervision. Remember to bring all the used EpiPen autoinjectors with you to the hospital. Give them to an emergency responder or healthcare professional. After getting medical help, stay close to a hospital or where you can easily call 911 for the next 48 hours. After leaving the hospital, remember to get and fill a new prescription for an EpiPen autoinjector. Watch this video as many times as you need to learn how to use EpiPen. You can also practice with the EpiPen trainer. For more information about severe allergic reactions and EpiPen, talk to your doctor or pharmacist.
Histamine is the main body chemical that's involved with allergies. Let's watch a quick video about it.
Histamine, friend or foe, or frenemy. From NIH Medline Plus magazine. Histamine. Is it the most annoying chemical in the body?
Plant.
It's the stuff that allergies are made of. Hay fever, food allergy, skin allergies. Histamine plays a big role in all of them. And those conditions play a big role in us. In 2015, CDC data showed that more than 8% of U.S. adults had hay fever. More than 5% of U.S. children had food allergies, and at least 12% of all U.S. kids had skin allergies. So what's the deal? Why do we have such a pesky chemical in our body? Well, histamine is usually our friend. Histamine is a signaling molecule sending messages between cells. It tells stomach cells to make stomach acid. And it helps our brain stay awake. You may have seen this effect illustrated by medicines that block histamine. Some antihistamines can make us sleepy, and other antihistamines are used to treat acid reflux. Histamine also works with our immune system. It helps protect us from foreign invaders. When the immune system discovers an invader, immune cells called B cells make IgE antibodies. The IgEs are like wanted signs that spread throughout the body, telling other immune cells about specific invaders to look for. Eventually, mast cells and basophils pick up the IgEs and become sensitized. When they come in contact with the target invader, they spew histamine and other inflammatory chemicals. Blood vessels become leakier so that white blood cells and other protective substances can sneak through and fight the invader. Histamine's actions are great for protecting the body against parasites. But with allergies, the immune system overreacts to harmless substances, not parasites. This is when histamine becomes our foe. Common allergens include peanuts, pollen, and animal dander. Leaky vessels cause tearing in eyes, congestion in the nose, and swelling, basically anywhere. Histamine works with nerves to produce itching. In food allergies, it can cause vomiting and diarrhea. And it constricts muscles in the lungs, making it harder to breathe. Most worrisome is when histamine contributes to anaphylaxis, a severe reaction that is potentially fatal. Swollen airways can prevent breathing, and a rapid drop in blood pressure could starve organs of vital blood. So what can be done about histamine? Antihistamines block cells from seeing histamine and can treat common allergies. Medicines like steroids can calm the inflammatory effects of allergies, and anaphylaxis needs to be treated with a shot of epinephrine, which opens up airways and increases blood pressure. So our relationship with histamine is complicated. We can do better. NIH, and specifically the National Institute of Allergy and Infectious Diseases, NIAID, support research of histamine and its related conditions. Great progress is being made in understanding allergy triggers and managing allergic symptoms, and figuring out why histamine, our frenemy, acts the way it does.
Our first class of medications are antihistamines. These basically block histamine. You may have seen these in the store before. They can all be bought over the counter. Our examples of these are diphenhydramine, also known as Benadryl, loratadine, also known as Claritin, cetirizine, also known as Zyrtec, and fexofenadine, also known as Allegra. Antihistamines are good for itching, sneezing, and congestion, but these can make you a little bit sleepy or drowsy, so be careful when you take these. Our next class of medications are steroids. You can tell because they end in "one", O-N-E. We have fluticasone, also known as Flonase, triamcinolone, also known as Nasacort, mometasone, also known as Nasonex, and hydrocortisone, which we only call by its generic name. Nasal sprays, like the first three, are really good for nasal congestion or if you're feeling stuffy. Nasal sprays don't really have any side effects, but they're not recommended for long-term use. Fluticasone and mometasone might sound familiar because they're also used in inhalers for asthma. And then hydrocortisone is really good for itching because it's applied as a topical. Some miscellaneous eye drops are Zatador and Visine, which you may have heard of. You can use these for red or itchy eyes. We also have decongestants, pseudoephedrine, also known as Sudafed, and oxymetazoline, also known as Afrin. You should also know that you should not take Sudafed if you have high blood pressure because it can worsen it. Instead, you might want to take a nasal spray. And Sudafed may also have other side effects such as headache, insomnia, and irritability. You should also know that you should not take Afrin for more than 3 to 5 days because it can make the congestion worse. Our last medication is called Montelukast, also known as Singulair, and it's an oral prescription medication that can be used for both allergies and asthma. Now we're going to talk about some allergy tips. First of all, if you're outside, try to stay inside as much as possible, especially when the pollen count is high. Second, try to wear sunglasses or a mask if your allergies are really bad outside. You should also try to avoid hanging your clothes outside to dry and avoid rubbing your eyes. Some ways to avoid allergens if you're inside are to use a humidifier, wash your bed often, and that includes pillows, blankets, and sheets, Clean the house and make sure you mop the floors. Wash your hands after petting animals. Wash your clothes after you're visiting people with animals. And avoid using window fans that point indoors. You should always point them outdoors so that the pollen doesn't get in. And finally, there's a couple of other things that you should know about allergies. First of all, allergies are most common in children, but they can appear at any age. Secondly, if you haven't had an allergic reaction to something in the past, that doesn't mean that you're not able to still develop an allergy. You still can. And last, some allergies do disappear, but also some will come back.
Allergies are one of the most common causes of illness, estimated to affect up to 1 in 5 people, and they are becoming more common around the world. Allergy occurs when our body becomes sensitive to a substance called an allergen that is harmless to most people. For example, common allergens include pollen, which causes hay fever, certain foods, such as nuts, milk, and eggs, insect bites, such as bee and wasp stings, dust mites, molds, animal fur, some medicines, and certain materials, such as latex. So, how do allergies occur? The immune system is how our body detects, remembers, and eliminates foreign material that is harmful to the body, such as viruses and bacteria, and allergens are treated in the same way. When first exposed to an allergen, the immune system creates a type of protein called IgE antibody that is able to uniquely recognize that allergen. After this exposure, the antibodies lie in wait on a type of immune cell called mast cells. If the allergen is encountered again, it causes an allergic reaction. The allergen binds to the antibodies, triggering the mast cells to release their contents, including chemical messengers such as histamine. These have a range of effects on the body. Common symptoms triggered by this reaction include itchy skin, rash or swelling, sneezing and runny nose, inflammation and congestion around the nose and eyes, cough and wheeze, diarrhea or feeling sick. These symptoms might be mild and occur over a period of time, but allergic reactions can also happen straight away. For some types of allergies, reactions can be severe and life-threatening, called anaphylaxis. In anaphylaxis, an extreme reaction of the immune system leads the blood vessels to widen and become leaky, dangerously lowering blood pressure. The eyelids, lips, or throat can swell up, and the airways can tighten, leading to difficulty breathing. Other effects may include anxiety, tummy cramps, vomiting, diarrhea, drowsiness, and loss of consciousness. Anaphylaxis is a medical emergency that can be fatal if not treated promptly, so it's important to seek help immediately. Some people who have had an anaphylactic reaction before might carry an adrenaline auto-injector pen prescribed by their doctor. This can be used whilst awaiting further medical help and is easy to use with the instructions on the side. It is important to go to hospital, even if you feel better, for a period of observation in case symptoms return. Here, further supportive treatments and medicines can be given if required. How are allergies diagnosed? When and where symptoms occur can provide clues. If these follow exposure to a particular allergen, as well as symptom history, family history is also relevant, as some families have a genetic tendency to develop allergic diseases called atopy. Allergy testing is also sometimes used to investigate further or confirm an allergy. These include blood tests for total and specific IgE antibodies and skin prick or patch testing, where tiny amounts of different allergens are introduced to the skin in a safe way to see if the skin reacts. If an allergy is diagnosed, there are many ways of reducing its impact. Firstly, it is important to try to avoid the allergen as much as possible. Medications are also available to help with symptoms. Antihistamines and steroids directly dampen down the allergic response. Other medications can provide symptom relief, such as skin creams or decongestants. If an adrenaline pen is prescribed, it should be carried at all times, as it's not always possible to avoid allergens. It's also important that allergies are recorded on your medical records. Some allergies can also be cured through immunotherapy. This involves being exposed to a tiny amount of allergen in a safe and controlled way and giving larger and larger doses over time so that the body gradually becomes desensitized to it. Allergies are very common in childhood and can be lifelong, though for many, allergies fade as they get older. While allergies can be disruptive and impact on quality of life, they can usually be managed through allergen avoidance, treatment and preparation. It is important for everyone, family and friends, and wider society to be mindful of allergies and the risks they pose to some people. We hope this health sketch has been useful for you and those around you. Health sketch. Health for all to see.
Now let's wrap up and review with some questions. Our first question is, what's another name for seasonal allergies? A. Summertime sickness. B. Hay fever. C. Fall blues. Or D. Allergic rhinoceros. The correct answer is B. Hay fever. Which of these is not a symptom of allergies? A. Fever. B. Coughing. C. Sneezing. Or D. Fatigue. The correct answer is A. Fever. What is true regarding anaphylaxis? A. It happens without exposure to allergens. B. It is a mild case of allergies. C. It's an emergency. Or D. It goes away all by itself. The correct answer is C. It's an emergency. Which medication is used for anaphylaxis? A. Antihistamines. B. Eye drops. C. Nasal sprays. Or D. EpiPen. The correct answer is D. EpiPen. Our last question is, true or false? All allergies are lifelong. A. True. B. False. The correct answer is B. False. Great job, everyone, and thanks for watching.